Hi, this is Dr. PJ. Thanks for watching my channel, and I wanted to talk a little bit more about testing for C19. There are two main types of tests, the diagnostic tests and the antibody tests. And the diagnostic tests have two different subtypes. One is called the PCR, or the molecular test, which is the one that people commonly have been getting since the beginning of this pandemic. And the second one, which is a newer development, is called the antigen test. The antigen test is supposedly a more rapid test. Turnaround time can be within an hour to 2 hours. And the antigen test tests for proteins on the surface of the C19 virus. The way to get this test done is very similar to the PCR test in that you take a specialized nasal swab that looks like a long Q-tip. They insert it into your nose and try to get a sample of mucus that has viral particles in it. So these viral particles and proteins are then tested for, and if it's positive, then we think that you have active viral particles in your system. Of course, you have to take that in context with the onset of your symptoms and your current symptoms and your exposure time, etc. So the antigen test is newer, is supposedly faster and rapid turnaround, and less expensive. There are some limitations. One of them is if you can't get a good sample. So if you are getting one of these tests and they're putting that swab in your nose, you just have to kind of hold still as long as you can so they can get a good sample. The second is if the sample that they take doesn't have enough particles in it, this is different from a PCR test because there's no way to multiply those proteins in the test like they do in the PCR polymerase chain reaction, so you can have a false negative test. The false negative rate of this test is higher than the PCR test. The PCR test we think is accurate in the high 90%. There's some early data that show that the antigen test is somewhere in the 80 to 85% accurate range. So that means 15 to 20% of people may have the virus, but it shows up negative. The thing that compensates for this is it's cheaper and it's faster. And so if you test positive, you're positive. But if you test negative but still have the symptoms, then you may have to get another test that's more accurate, like the PCR test. So hopefully this information helps you, and everyone out there, stay safe.